How are you all? Suppose you are fired up. Been all these exciting things going on the last day, eh? Okay. We discuss so that your people may understand and be able to perform when it is time for them to do so. Thank you for hearing and answering our prayer. All these things I ask in your son's name. Amen. So well, I used to love my job, but I love my job even more now, right? So I always loved being a nurse, and I love being a midwife, and I love being, I'm going to say, a naturopathic nurse midwife. So I'm going to be looking at obstetric emergencies, just giving you some highlights. It's really a long presentation, so you're only going to be getting brief synopsis of it. The midwifery course that is coming up will have the full details of obstetric emergencies and pregnancies and all those things. But this is just a brief thing. And I know you all want to get into your cooking later. So let me start. All right, obstetrics in the Bible, before we go there. Now, is there anybody can tell me about obstetrics in the Bible? Where do you see pregnancy events in the Bible? Anybody remember anything? Anything stands out to mind? Sister Mary, go ahead.
And the baby Jesus.
Awesome one. What's an example? What is that an example of today? Or what you could say in this modern scientific time? Go ahead, Sister Shan.
Okay, I'm saying when Pharaoh had given the command for the children, the babies to be killed, and the midwives, the boys, that is, and the midwives weren't carrying out that order. And he would ask
Right.
what it was, and he would say, the ladies are so quick, by the time they get there, they already deliver.
Right. So there's a couple things that you learn from that lesson. One, that midwives are persons of integrity, right?
Right.
They could not follow through with an unholy command to kill the babies. And two, it tells us that the term that they use, that the Jewish ladies are quick. So you do have labors that are quick. And in the medical fraternity now, we call that precipitated labor. All right. So no, that's one of them as well. And in regards to baby Jesus, the Sister Mary saying, I mean, you could say for now that it's a in vitro fertilization, you know. There was no, I mean, a woman getting pregnant without, sexual intercourse, so to speak, right? So you have that example. And there are many examples in the Bible. Um, and we're just going to be looking at a few. Um, oops.
And I see in the chat here we have Rachel mentioned and Sarah. So we have our twin births.
Right. So Genesis 30, verse 3, cue us into the proper position for delivery, even though that is not the position of choice no for delivering. It says that Rachel says to Jacob, go unto my maid Belial, and she shall bear upon my knees, right? And Professor Dunn commented on it to say that it concludes that the upright sitting position was normal adopted during labor and delivery. However, no, the position that is adopted during labor mostly is a lying position. Most times the sitting position is usually only offered with persons who are probably having twins or persons with cardiac issues and whatever. But it is the choice of delivery. It really makes it very easy. And I know, the persons of African descent, they are very skilled in delivering based in the stooping position. Genesis 35, verse 16 and 17. And they journeyed unto Bethel, and there was but a little way to come to Ephrath. And Rachel travailed, and she had hard labor. And it came to pass, when she was in hard labor, that the midwife said unto her, fear not, thou shalt have this son also. And the comment on this one was that the midwife, how did the midwife know that it was a son? There's no ultrasound. Or how did she know that it was a son that being bare? And so it is theorized that it was a breech delivery, because that's the only way you can know the sex of the child. And the next point that you can get out of it is that he said that she had a hard labor. So we do know that labors can be hard, right? And we're going to be looking at some some complications, some emergencies, um, of what can happen, how we can, once we are educated about these situations, we can avert them. What is obstetrics? According to the Oxford Dictionary, obstetric is the branch of medicine and surgery concerned with childbirth and midwifery, right? So obstetrics is the branch of medicine and surgery concerned with childbirth and midwifery. What is midwifery? Midwifery is the health science and health professional that deals with pregnancy, childbirth, postpartum period, and this include the care of the newborn, in addition to sexual and reproductive health of the woman throughout their lives. So midwifery is actually a lifetime health science, then, so to speak. Or when you become a midwife, you become a midwife to care for every aspect of a person's life. You are there with the woman pre-conception to give her advice, what she should do, help her to get pregnant. You are there with her throughout the pregnancy, helping her to keep the pregnancy healthy. You are there at the delivery to guide her through a safe delivery. After the delivery, you are there assisting her with breastfeeding and all those other issues. You are there with the mother and the family, rearing, helping to rear the toddlers, those early childhood years. You are there in adolescent period, guiding, teaching about puberty and family planning and all those things. You're there in early adulthood again, teaching your teenagers how to take care of their body, early adulthood persons how to take care of their body, good sexual practices, and all of that. And then when they are so guided and they become partners with you know their spouse and they get married and they become pregnant, you are there again. So it's a lifetime care that you give. And I will tell some more about that later on. All right. Pregnancy. A full term pregnancy lasts approximately 270 days, approximately 38.5 weeks from conception to birth. But because it's easier to remember the first day of the last menstrual period than to estimate the date of conception. Obstetrician, obstetricians set the due date as 284 days, which is approximately 40.5 weeks or 40 and a half weeks thereabout from the last menstrual period. And when Brother Bob was presenting yesterday about the gestation of the different animals, this particular slide came back into my mind. The 40 weeks of an average pregnancy are usually discussed in terms of 3 trimesters, each approximately 13 weeks. During the second and the third trimesters, the pre-pregnancy uterus is about the size of a fist and grows dramatically to contain the fetus, using a number of anatomical changes in the body, in the woman. What are some obstetric terminologies that we are going to keep in mind? And I'm just going to briefly tell you this. I'm not going to go through all of them because of time. All right, gravida. When you are, the midwife will say that, what's your gravidity? It speaks to the number of pregnancies. Pregnancy losses are represented as a plus. All right. Parity. Parity speaks to the number of viable gestational age birth. Now, if you deliver a baby that is not viable, which means that um, life cannot be sustained because their organs are not developed, then it's not considered a parity. And we're just looking at some examples here. If, for example, a woman is gravida 3, para 2, it's saying that she has had 3 pregnancies and 2 deliveries. Remember, parity speaks to the birth or delivery, right? So she's had 3 pregnancy and 2 deliveries. That means she's still pregnant. If it was a gravida 5 para 2, it speaks to 5 pregnancies and 2 deliveries. 2 losses, which wasn't indicated, but it can be written that way as well. And the woman is still pregnant, right? Another way of writing fetal loss is by quantifying it more detailed. And we look at the next example for that. Say the person was gravida 6, para 3 plus 2. And I'm going to explain the loss now. So it is saying that the woman that has 6 pregnancies, 3 deliveries. So these were viable births, which means that these were term births. 2 non-viable losses. That is represented as the plus 2, which means that these pregnancies would have been before 28 weeks, right? The viability is marked off at 28 weeks in the Caribbean, in the United States, where they have more sophisticated facilities. It may go up to as low as 24 weeks, right? But on average, it's 28 weeks. And the woman is still pregnant in this particular example. Say you saw gravida 3 para 3 with one SB in the bracket. It is saying that the woman has had 3 pregnancies and 3 deliveries, including a stillbirth, which is a baby born dead. So the woman gave birth to the baby, but at delivery, the baby died, or the baby died before delivery, but you know, it's a stillbirth. And you will hear the term fresh stillbirth or fresh SB to denote a woman whose baby has died at during delivery. That's a fresh stillbirth. So when the baby comes out, the baby looks as if he could have been alive, but he's just sleeping. So it's a fresh stillbirth, which means that he died during labor, right? And in this scenario, the woman is not pregnant. Another way of writing gravity and parity, gravida 4, para 4, and in the bracket you have 1 SB, 1 neonatal death. All right, so this is a woman who has had 4 pregnancies and 4 deliveries. These 4 deliveries include two, two, two live births. Well, they include 3 live births. 2 babies are still alive, and one SB, one stillbirth, so 1 baby born dead, and 1 baby that born alive but had a neonatal death, right? And this woman is not pregnant. Let's look at another. Gravida 2, para 3. Now, how is that possible? Her gravida, which means the number of times she was pregnant, is less than the amount of babies that she has. So, how is that possible? This means that she had a set of twins. So, gravida 2, 2 pregnancies, and there are 3 deliveries, including a set of twins. All right, this woman is not pregnant. All right, the last example we'll look at, gravida 4, para 4. This is another way of writing the set of twins. 1 set of twin, 1 SB, 1 neonatal death. This is a hard one. Look at this. There have been 4. This woman has had 4 pregnancies, 3 deliveries, including a set of twins. So that is 4 babies, right? 1 baby born dead, that is 5. And 1 baby born alive but died as a baby. So that is 6. And the woman is still pregnant. So do you see that? It's 4 pregnancy. 1 pregnancy was twin, so you call it 1, 2. The next pregnancy was okay. Next pregnancy is okay. Those are 4 babies. Those are 3 deliveries. Then the next baby, the fourth pregnancy. I think I'm confusing myself. All right, let's go again. So the woman has been pregnant 4 times, right? She has 3 deliveries, including a set of twin. Let's count the loss first. So 1 baby died, born dead, 1 baby born alive and died. Then she had another pregnancy with 2 babies, right? But remember, it's 4 times she's pregnant, so she is still pregnant. So that would be the 4th pregnancy. Do you understand? What is the difference between midwifery and OB/GYN? They are basically the same. OB is abbreviation for obstetrics, which we defined just now, and GYN is the abbreviation for gynecology. Gynecology is the study of the female reproductive system. So it speaks to pregnancy and non-pregnant women. So all the issues that you could be having outside of pregnancy, vaginal discharges, sexual transmitted disease, um, um, cervical cancer, um, abnormal pap smear, all those things. Having recurrent yeast infection, those are gynecological issues. If you've had imperforated hymen, prolapse, uterus, prolapse, cervix, menopausal issues, all of those fall under gynecology. Obstetrics now is that branch of gynecology that speaks specifically to pregnancy. All right, let us move on. I want to get to the juicy parts. Okay, a few more. Last LMP speaks to last menstrual period. LNMP is the last normal menstrual period because persons don't always have normal periods. And sometimes a woman may be pregnant, but they tell her that they had a period last month, but it wasn't really a period because it didn't last for the amount of days. It didn't look the same way. It wasn't the same volume. So it's not a normal period, okay? EDC speaks to expected date of confinement, or EDD, which is the same thing, expected date of delivery. When is this woman going to be delivered? And all right, we're not going to look at these. All right. As I said before, we are going to be offering a midwifery course. And we're going to be going into in depth in some of these things, but we're just looking at the emergency. What do you do if your next door neighbor call you to say that I'm going into labor? It's in the middle of the night. You can't move. It's a hurricane or something is happening and you cannot move her. What do you do? Right? What are some of the things that you should look out for? Those are some of the things that we want to get into. All right. All females of childbearing age are presumed to be pregnant until proven otherwise. I think this is such an unfortunate statement because some people, you don't need to check them, but it's actually saying that they're saying that once you're a woman of childbearing age, anything can happen. And I'll tell you a little story. I had this lady. I was not a midwife then, but I was at working at Victoria Jubilee Hospital, and this lady came in to the hospital. The labor ward was being refurbished, and so we were housing them at a different location of the hospital. And she looked quite elderly. She looked not very, very elderly, but she looked up in age. And when I looked at her file, she was like about 46, 47. I remember that being in the late 40s. And she was having so much pain. And I was asked to take her information, her name and age and the history and all of that. So I was, taking the information. I was a student nurse at the time. Student RN nurse. So you know how long that was ago. And when I was taking her information, her issue was that she was downtown in the market selling, and she started having this some wicked belly pain. Start having some serious abdominal pain. Right? So she came to the Kingston Public Hospital and they sent her over here. So I was saying to her, so have you been going to any clinic? She said, what are you talking about? No, she was well, nothing wrong with her. She was just doing her work, selling her vegetables, and she started having the pain and cold sweat start wash her, so she came in. So she come to the doctor to find out what is happening. You know that the lady didn't know she was pregnant. The lady did not have a clue she was pregnant. And I was there now, didn't know what to do. So I called the midwife and, they spoke with her and said, but miss, you are pregnant. She said, what? What do you mean? How that possible? So the midwife, good naturedly said to her, 9 months ago, did you meet somebody special? She said, 9 months ago? What are you talking about? So the midwife said, Miss, you're going to have a baby. She said, but that can't be possible. We never feel no way different. Um, so the midwife said to her, so were you having a period? She said, when was the last period? She said, probably don't. I don't remember. It was a long time she not have period. She just thinks that she are going on menopause. So the midwife said, you didn't feel anything moving? She said, no. So the lady had no antenatal care at all. She did not know she was pregnant, but she proceeded deliver a bouncing baby boy in her old age, and she was embarrassed plus tax. She did not take it. She was so embarrassed. So what she going to do with this baby? What she don't even she couldn't even remember the dad. You understand? It was an experience. So when it says all women of childbearing years should be presumed pregnant until proven otherwise, that is the whole aspect of the situation. All right. So during pregnancy, a lot of changes happen with your vulva, with the vagina, the secretions, the uterus, weight gain, your cervix, the tubes, the ovaries, your breasts, the skin, your abdomen, of course, because you're going to see the changes, the blood volume, your red blood cell count. There are metabolic changes that occur, your oxygen demand, your your iron demand, your cardiovascular changes. Many. Our bodies are so wonderfully made. There are changes in the urinary system, the kidneys, the urethra, the stomach, the nervous system, so many different kind of changes, which we will go into more detail in a more detailed course. What are some of the reasons that can cause false negative pregnancy tests? Number one, you can do the pregnancy test too early, or you can, if the urine test that is being done is too diluted. Now, what is used to test the urine test is a chemical called um, BHCG, right? And it is found in the urine, it is found in the blood as well. But the BHCG is at its highest in the early morning urine. So, say for example, you missed your period and you wanted to know if you were pregnant, but it's in the middle of the day, you're at work, and your friend said, just go do a pregnancy test, and you decide to do the pregnancy test. It's 12 o'clock in the day, and you do the pregnancy test. It is likely that for you to get a negative reading. And if you do that for the first 6 weeks, it's likely for you to get a false negative reading, right? Because the beta HCG is low, and it's especially low during the middle of the day. It's at the highest overnight. So it's best if you use the first urine of the morning to test it. Um, False negative results can also occur if you have a ectopic pregnancy, which is a pregnancy that is in your tubes, and we will speak to that further in the presentation. Also, incomplete abortion can give you a false negative um, pregnancy result, which means that you have actually lost the pregnancy. So that is the reason why there's a negative result on the test. What are some reasons that could give you a false positive pregnancy? This can occur if there is hematuria, right? What is hematuria? Heme, blood, urea, urine. So if there's blood in the urine or protein in the urine, you can get a false positive reading because the beta HCG is a type of protein. And so if you are not using a very sophisticated um, pregnancy test, you can get a positive pregnancy reading when it is when you're not really pregnant, but the kit is picking up protein in the urine from either blood or just pure protein. Um, Also, you have serum results that can give you a positive pregnancy test. The thyroid issues or molar pregnancies, which we will go further into. Um, Also, you have medication, and I want you to take particular note of these, right? Drugs that may cause false positive results. These include your anti-anxiety medication, so such as diazepam, same thing as it's just another name for Valium, or alprazolam, which is the same thing as Xanax. Your antipsychotics, such as your clonazepam and your chlorpromazine. Those are your antipsychotics medication. Your anticonvulsants, such as your phenobarbital or other barbiturates, your Parkinson's disease medication, including your bromocriptine, and the other name for bromocriptine is your parodel. Your diuretics also can give you a false positive pregnancy test. That's your furosemide or Lasix. Um, Also, your antihistamines, including your promethazine or your methadone or your dolophin, right? These can give you um, false positive results. All right, let's get going. All right. Emergencies in early pregnancy. What are they? What are some of the emergencies that you can experience in early pregnancy? Three main categories: bleeding, hyperemesis, um, that is excessive vomiting, and trauma. Right? Complications in pregnancy resulting from vaginal bleeding. That's in your first trimester. I remember we said the first trimester is the first 13 weeks, right? So you can have your ectopic pregnancy can cause vaginal bleeding, your abortion, molar pregnancy, non-pregnant related things such as infections, trauma, and neoplasm. Neoplasm means cancers, all right, or tumors, okay? All right, so usually if the woman is pregnant and having vaginal bleeding, you want to find out if the os is open. And if the os is open, whatever is coming out, is there any products there? Does it look fleshy? Is it a scant amount? If it's a scant amount, it might lead to an inevitable abortion, which means that the woman will abort spontaneously, despite what we do. If it's moderate or severe amount of products, it may give you a clue that she might have had an incomplete abortion, which means that she has lost the pregnancy already, but there are portions that are still there. And that is the reason why the bleeding is heavy, because the uterus can't contract. There's something still inside it, all right? If the bleeding is there, but the os is closed, and we're going to go into how to know if the os is open or closed, all right? And the os is closed, um, you won't be able to see the product of conception. You won't be able to see um, if there's any tissue or anything like that, right? So if there's no tissue, no fleshy material, but there's active bleeding, if there's no active bleeding, then you're going to think that she had a misabortion, which means she has lost the pregnancy, um, but it might still be in the system. You understand? If there's active bleeding, then there's a threat that the woman is losing the pregnancy, but it is not yet gone. She may have a chance of you may have a chance of keeping that pregnancy. If there is product of conception, then it will lead you to think that the abortion was complete, right? So the loss was complete, right? Miscarriages. Now, 1 in 10 pregnancies will result in a miscarriage. It usually occurs in the first 13 weeks of pregnancy, that's the first trimester, or before the 20 or for 20 weeks. Tissues should be safe for analysis. Why? Because you want to know what is the cause. Remember, that's a principle we function on. And when you know what the cause is, it that was a genetic, most miscarriages that occur early in pregnancy are from genetical malformations. God has made us so wonderfully made that if the body sense that there is some deformity in the gene pool, the mixing of your genes, your 13 chromosomes with your husband's 13 chromosomes, there's some malformation, there's some mix up going on, it will spontaneously abort the fetus. So miscarriages can be a good thing. All right. Sometimes women are devastated when they have become pregnant and lose the pregnancy. Be comforted. If it is in the early pregnancy, it can be that it would have amounted to a deformed child. You understand? So some of the times this is how the body was created to get rid of to preserve our gene pool, then to make sure that we are completely human. We have the character of God. You know what I mean? We are physically in His form, right? Okay. And in abortions now or miscarriages, you have spontaneous abortions, you have threatened, which means that it has not occurred yet, but it's likelihood to go both ways. You have criminal abortions, and we're going to look briefly at them because we want to get into the meat of the matter. The spontaneous abortion, commonly called a miscarriage, and it occurs on its own. It occurs before the 12th week of pregnancy, which is in the first trimester, right? And many occur within 2 weeks after conception, being mistaken for a menstrual cycle. So sometimes you would have gotten pregnant and lost the pregnancy and not even realize it. Criminal abortion is where an attempt to destroy a fetus by one who is now licensed to do is whom is not licensed to do so. So persons sometimes, teenagers sometimes, young women, and I dare tell you, other mature women as well, have found themselves in a situation where they are pregnant and they decided that they don't want this pregnancy. And so they've used hangers and all manner of different things to get rid of the pregnancies. And sometimes they end up hurting themselves, and this can cause excessive bleeding and put them into problems. And I've seen that. Therapeutic abortion. This is where the pregnancy poses a threat to the maternal life. So the woman's well-being is threatened, and a decision is made to terminate the pregnancy to preserve the woman's life. So we're going to look in detail now at the ectopic pregnancy. What's an ectopic pregnancy? This is a fertilized ovum which implants outside of the uterus. It occurs in 1 in 200 pregnancies. You see how often it occurs? 1 in 200 pregnancies. 11% of all maternal deaths in the US is due to hemorrhage. And I will tell you, there are three main things that cause maternal death: bleeding, hypertensive emergencies, and infections. Those are the three main things that will take a woman's life during pregnancy. Risks include: how does a woman get ectopic pregnant? What are the risks? What predisposes her to an ectopic pregnancy? Um, Pelvic inflammatory disease, right? Previous tubal pregnancies, tubal ligations, the use of intrauterine device, um, recurrent vaginal infections that weren't treated properly can also be a predisposing factor. What are some of the signs of the ectopic pregnancy? The woman would have vaginal bleeding, abdominal pain, amenorrhea, which means that there's no period, right? And then may have signs of shock, may not know that she's a pregnant, right? So, and I tell you this because women will talk to their friends, and you have a young woman, a colleague, a church member who will say to you, I'm not understanding. I'm having this bleeding, my period seems to be going so long, and I just feel so weak, and I have this severe abdominal pain. As a health person, the first thing that comes to mind is that I wonder if she's pregnant. I wonder if it's an ectopic pregnancy. Things like that, right? If you're not trained, you wouldn't think that. But um, these are some of the things that we look at, right? If it is not your period, or if your period seems to be not normal, it could suggest something else like an ectopic pregnancy. Now, an ectopic pregnancy is an emergency. It is a life-threatening condition. Let's look at the next slide. It will, all right, predisposing factors. Remember. So ectopic pregnancy. This is what happened now. Now the egg is fertilized and it begins to multiply. So this is day 2, day 3, right? It's going on there, day 4. No, you're pregnant here now. The egg is fertilized, right? So you have this here. So this is a normal course of things, right? And it comes down and it implants into the body of the uterus. However, if it's an ectopic pregnancy now, it can plant in the infirmary, that's right in the tube there. It can implant itself at the top of the tube. It can plant itself where the tube meets the uterus. That is a ischial tubal pregnancy. It can plant itself at the head of the uterus. Um, this can become a viable pregnancy. The cervical, if it's implant itself right here, this can result in um, a placental issue. We will go into it further later on, right? So anywhere off here, if the pregnancy, the developing fetus, blastocyte is planted anywhere around here, it can be dangerous. No, look at the size of the tube. Look at the size of a baby. This is a baby going to be growing right here. So usually the tubes will rupture, right? And that is going to cause extreme bleeding, right? The woman can have internal bleeding and just go into shock. She might just look okay. I'll tell you, I remember a young girl coming to the hospital, and she was being admitted to the gynae ward, right? Because she did not have a period, but she was having some severe pain, and they thought it was either ectopic pregnancy or some severe painful period. And I was admitting her. Um, it was like about 2 a.m. in the morning, and I was admitting her. She was 18. Her father came with her. So while I was admitting her now, um, I asked her when was her last period and asked her when if she's pregnant. So she looked behind her and saw her father, and she said no. So he came and said, "No, so she said you're pregnant." I said, "No, sir. Just have a seat, and I will. When I'm finished with her, you can speak with her." So I discreetly asked her, "Are you pregnant?" And she said, "Yes." I said, "How long now you know that you're pregnant?" She said, "1 month." And because of the symptoms she was having, I was there thinking, she sounds like she might have a ectopic. It was on my mind. So I got up from the desk to call the doctor to say, "Listen, I have an admission and I think she may be ectopic, so you need to come over." Brethren, do you know that by the time I turned around, the lady collapsed in the chair? She was an ectopic pregnancy, and the tube ruptured and she was bleeding inside. And she moved from looking like a brown girl to a white. She looked so pale. It was my first experience with that situation. And they had to just rush her straight to theater, cut her out of her clothes and everything, and in order to save her life, because she lost so much blood. We had one incident, and it wasn't a long thing. She didn't stay home with it. You understand? So sometimes when we have pains and you think, oh, it's just my period or whatever, we have to be so careful. You understand? All right. Then a next complication in early pregnancy is what we call hyperemesis gravidarum. This is where um, a woman will have severe nausea, vomiting, weight loss, and especially um, possible dehydration because of it. So once it reaches this stage, it's called hyperemesis gravidarum, and it can be life-threatening as well. It can cause metabolic changes and affect our kidney. And if that happens, it's called Wernicke syndrome or something like that, if I'm remembering, right? Um, but it can be, but isn't vomiting in pregnancy normal? Is vomiting, let me see here some hands. Is vomiting in pregnancy normal? Warren, I don't know what your hands was up for, but I'm asking you that question. The mic is open now. Go ahead. Sister Rowena?
Yes. No, I don't think it's normal. If the system is working right and is in good condition, healthy, you don't vomit.
Okay, praise the Lord, sister. What was your question?
I don't know how that hand go up.
Oh, well, the Lord wanted me to ask you that question. All right. So, pregnancy, vomiting in pregnancy is not normal, right? We should not have this not being able to tolerate food and all of that. All of these things happen because of nutrient deficiency. I just saw a hand. I guess the person don't want to ask the question again. One of the main things that cause vomiting in pregnancy is a lack of magnesium. And so it's important that when a woman becomes pregnant, that the magnesium level is looked at. If you increase the magnesium level and the zinc, and you look at the trace minerals, and you ensure that she is now taking food rich in these supplements, rich in magnesium, rich in your zinc, rich in your trace minerals, then this eliminates all this nauseous vomiting situation that people find themselves in. Okay, Sanya, you were pregnant and never had a vomiting issue, which means that you were probably a healthy pregnancy, healthy pregnant woman. That is good. What happens if a person is ovulates during pregnancy? Well, what happens is that there's some amount of hormonal imbalance while you are ovulating while being pregnant. That's one. Two, it means then that you can also get pregnant while you're pregnant, right? Which means that you can end up with fraternal twins, right? But that is not generally normal. It's because of the imbalance in hormone. When a woman becomes pregnant, progesterone is released, and so that is going to prevent the formation of other eggs. So you should not be ovulating. Okay. All right. What is the difference between morning sickness and hyperemesis gravidarum? And you need to know this so that when you see somebody who's pregnant having these kind of symptoms, you can say to the person, listen, number one, you're going to say to them that vomiting in pregnancy is not normal. You need to look at your nutrients, start eating these kind of foods rich in magnesium, rich in this, so that you can get rid of the morning sickness. But if the nausea is accompanied by severe vomiting all the time, it means that it's hyperemesis. In morning sickness, the nauseousness is just sometimes accompanied by vomiting, right? You just feel nauseous, but you don't always vomit, right? In morning sickness, it subsides after the 12 weeks. And this is because of the hormone that is being released to maintain the pregnancy. And because of the overproduction of this hormone, it causes this digestive upset, and it give you this nauseous feeling, especially because the nutrients, that particular nutrient, those nutrients are diminished. But in hyperemesis gravidarum, nausea does not subside. So after the 12th week, 13 weeks pregnant, 14 weeks, 16 week, person is still vomiting every morning, still vomiting throughout the day. That's sign for trouble. Vomiting that does not cause severe dehydration would fall in the morning sickness section. But if the vomiting is every day, 2, 3 times for the day, then it may cause dehydration. Like vomiting that allows you to keep some food down, so it's just morning sickness. But if when you're vomiting, it doesn't keep you don't keep down anything at all. So you're always just vomiting. You don't have a chance to eat anything. If you drink water, you vomit. Nothing at all stays down. Then that means this condition is no longer morning sickness, which is quote unquote socially acceptable, even though it is a disease in itself. It is no hypersensitive gravidarum if you are not able to keep down anything at all right? And this person should be advised to seek medical attention, all right? Because it can damage their kidneys, right? It can cause life-changing situation. How do we know? Okay, this is not the slide I want. All right. How do you know that the person is dehydrated? How can you tell? Signs of mild to moderate dehydration include constantly being thirsty. Now, you know, based on the training, that once you feel thirsty, it means that you are dehydrated. Your body, we are so wonderfully made that the body will pull fluid from wherever it needs to pull it to make sure that it gets the fluid that it needs. And if it is not able to pull fluid from anywhere, you're now going to start getting the sensation of thirst. that my resources is now low. You need to replenish, and so you get that feeling of thirst. Now, remember, on a normal basis, your you lose 1.5 liters of fluid every day normally through urine, sweating, by talking, just normally 1.5. So if you are not taking more than 1.5 liters of fluid, I mean, if you're not taking in that amount, you are not helping your body to replenish. You're just maintaining at the 1.5 that is losing. Right? If the person experiences a dry mouth, that's considered mild to moderate dehydration. If the person is always tired, always want to sleep, or the person has a headache, those are symptoms of mild to moderate dehydration. Now, dehydration becomes severe if the person may have rapid breathing, right? Or rapid heart rate, what we call tachycardia, all right? Or tachypnea, if the person is breathing fast. Or they have a severe dizziness or lightheadedness. This could all be because of dehydration. And again, dehydration can be severe if there's unconscious, the person become unconscious or, talk, um, bewildered. They're not sure of what is happening around them. They become spaced out at times. All right. Trauma in early pregnancy. I want to just go to because we are against time. What are some of the emergencies in the second trimester? Again, bleeding. Bleeding is the leading cause of obstetric emergency in any of the trimesters. So we're looking at bleeding again, trauma, motor vehicle accident, and I will tell you, even though the pregnancy is now 14 weeks, 16 weeks, 20 weeks, we do find women who now believe that, listen, I need to get rid of this pregnancy. I can't afford to be pregnant. Teenagers, young adults, older adults who find themselves in a situation and find that they think that there's no other way out. This is the only way. And so they try to hurt themselves to get rid of the pregnancy, inflict harm on themselves to get rid of the pregnancy. Again, domestic violence also, and incidental accidents can cause trauma to the abdomen and cause fetal loss. Hypertensive emergencies are another set of emergencies that we look on in the second trimester. Infections of the kidneys, the urinary tract, the bladder, and the appendix can also be emergencies that result in the second trimester. One of the hypertensive emergencies that may occur in the second trimester is called preeclampsia. Our preeclampsia is an elevated blood pressure that is accompanied by protein in the urine, swelling or edema, and it may result in seizures. But I have found persons with just elevated blood pressure that have been preeclamptic, persons who are pregnant who just have protein in the urine and a slight elevated blood pressure, right? And this condition can become life-threatening as well if it is not treated adequately. It can lead to complications such as seizures. And when this happens, it is no longer called pre-eclampsia, it is called eclampsia. And the eclampsia can lead to a HELP syndrome, which is hemolysis, elevated liver function tests, and low platelets. And in this situation, the woman is likely to bleed. So there are hemolysis, which is the breaking down of the blood cells. There's elevated liver function, so there is jaundice, right? And then there's low platelets, which means that she cannot clot. Now, when the woman is pregnant, the blood volume is increased by 30%. So she has this extra amount of blood or blood volume that when you have a low platelets, losing all that blood can be very dangerous. All right. And this is all because of an elevated blood pressure that wasn't treated properly and that occurred in the second trimester, and it can be very life threatening. Now, one of the main treatment for pre-eclampsia or eclampsia is we give them IV magnesium. So, as medical missionaries, as upcoming doulas, right? Because I know all of you are going to want to do your midwifery program, become doulas or birth attendants. Magnesium. You need to ensure that the woman is getting magnesium when she's pregnant. This will help to lower the blood pressure, help to prevent her from going into this state. All right. Remember, we said pre-eclampsia usually occurs, um, is a hypertensive emergency before the 20th week, right? Are you hearing me now? Somebody saying that the volume is low. All right, so you have mild symptoms and you have severe symptoms. In the mild symptoms, the blood pressure is just slightly elevated, probably just up to 140 with a diastolic of 90. For protein, urea, I you might find a trace on the urine, but then when they do the 24-hour urine collection, up to 3 grams is found in the urine. There may be edema, so the ankles are swollen, or there may not be any edema. She might not have any problems with urine. She might not have any associated symptoms. Blood investigations are normal, and there's no effect to the baby. IUGR is intrauterine growth retardation. And when a woman becomes preeclamptic, it affects the placenta, which nourishes the baby. If it affects the placenta, then the baby cannot grow properly. And so you have intrauterine growth retardation. If the preeclampsia is severe, then the blood pressure is greater than 160/90. There's more than 5 grams of protein in a 24-hour urine collection. There is edema. There is little urine, right? Other symptoms that may happen is that they have visual symptoms. They will tell you that they see spots before their eyes. There's abdominal pain. There is pulmonary edema as well, which means that they are constantly coughing, or they say that they have cold on their chest, but it's because of the shift in the sodium, and so that's causing the potassium sodium mechanisms that's causing the edema, and that is going to cause fluid to be retained in the lymphatic system and in the blood vessels, and it accumulates in the foot and it goes up to the abdomen and can cause this pulmonary problem, right? The lab results will be deranged in a severe case. IUGR is present, which means that the baby at 30 weeks or at 24 weeks, you would expect the pregnancy to have a big belly, but she have a little tiny belly. The baby's not growing. The baby's not putting on any weight. So, these are some of the things that can happen if it's a severe case. And of course, we said it can go into that life-threatening situation where the woman develops the HELP syndrome, where it affects the liver and the kidney and cause excessive bleeding. These in these conditions, you want to send the woman to the hospital. This is not conditions that you are going to treat. We are telling you about it so that you can advise the woman. It's not normal for you to be having um swollen ankle throughout your pregnancy. You will get swollen ankle in late pregnancy because of the weight of the baby, and if you are in a situation where you're constantly standing, but as soon as you lie down and put the foot up, the edema, the swelling comes down. If that is not the case, that is not normal, right? And if you have persons who are having these experiences, you have to say, you need to get this checked out. You need to do some more investigation because it is not normal for your ankle to be completely swollen all the time. Again, in preeclampsia, as we said, the blood pressure is elevated. Sometimes the weight will be elevated because of the excessive fluid that is on board. There is protein in the urine. The woman have blurred vision, headache, and is very irritable. There is swollen, or what we call pitting edema of the legs. And I have seen women, do you know what an orange skin look like, right? And they are so swollen straight up to the abdomen. Straight up to the abdomen. The vagina is swollen, the belly, the lower belly is swollen. You can't hear anything on that baby because the belly is so swollen with extra fluid all around. And again, it will result in muscle twitching and seizures. All right. Right. We did with high blood pressure. This is the same thing. Appendicitis. Why would a woman be predisposed to appendicitis during pregnancy? And let's look at this. During pregnancy, as the baby grows, it displaces the transverse colon. And so the appendix that is supposed to be at this level here is moved up into the abdominal cavity further up, where it is now exposed to other areas, and it can easily become infected outside of the place that it's supposed to be. All right. Urinary tract infection in the second trimester is a serious emergency as well, and it can cause premature labor. Intrauterine infection can be caused by using condoms and spermicides. So it's important that we counsel women to stick to their own partner, right? And if you're pregnant, please do not go to different partners, okay? The UTI, the urinary tract infection, can be caused by the increase in the uterus size. As the pregnancy grows, it compresses the urethral tract and cause stasis of the urine, and that can cause an infection, right? Hormonal changes can cause urinary tract infection. Intercourse can cause urinary tract infection because the urethra, the opening of the urethra, is right above the entrance of the vagina, right above there. So if intercourse were, for want of a better term, dirty sex, it's not really that, but mean you are having intercourse with unwashed bodies, then so to speak, then you can introduce bacteria into this section, and it can cause infection. A pregnant woman's immune system is generally lowered, right? And so we have to teach them how to boost their immune system so that they are not exposed to things like that. Um, Bladder reflux, which again occurs because the uterus is getting bigger, the baby is pressing on the bladder, and so it causes these kind of things. What are emergencies that may occur in the third trimester? Whew, time is going. All right, we dealt with the hypertensive emergencies already. We want to look at some placental emergencies. right? Um, so the third trimester is 28 weeks and over. And you can have placenta abrupta or placenta previa. Placenta abrupta is the separation of the placenta from the uterine wall before pregnancy, before delivery, right? And so the woman may experience painful, dark bleeding. So the blood is very dark, which means that it's dark because it's not fresh blood. So the placenta has torn off the uterus, the blood leaks out, is collected, and then it will slowly come down into the vagina. So the blood is not a fresh looking red active blood, you know what I mean? It's an old blood. So it looks very dark. And this can be caused by high blood pressure, it can be caused from smoking, it can be caused from cocaine use, multiparity, previous abortions, previous abruptions, trauma can cause it. A woman who meets in a motor vehicle accident can have a placental abruption, things like that. Again, this is a life-threatening situation, and you want to get the woman to the hospital as quickly as possible. All right. Placenta previa is where the placenta itself is placed low over the cervical os, right? And it causes painless bright red bleeding. Usually, depending on how usually depending on where it is placed, will determine its management, right? But mostly cesarean section is the type of delivery. That does not reduce the risk of bleeding because, well, it reduces it in some sense. If the location of the placenta is known and the borders can be easily identified on ultrasound. If it is not easily identified on ultrasound, instead of having a low segment cesarean section or what we call a bikini cut, they will have to give the woman a transverse um, incision, which means that she gets a cut longitudinal, like from the navel going down or across, but up high in the uterus, and that in itself increases the risk of bleeding by 3, right? The placenta itself is very vascular and can and will increase the risk of bleeding, right? But even going through the muscular layer of the uterus can cause excessive bleeding as well. So anyway, I take it's a serious emergency, and you would not know about these situations until it happens or if it can be diagnosed on ultrasound. Abrupture placenta. Remember we looked at that? This is where the placenta tears off. So this is a normal placement of the placenta, right? And this is where it has detached. And so when it detaches here, the blood slowly leak here, and then it comes down into the vagina. So it's because it will look all dark blood, right? So it is from partial or complete detachment of the placenta after 20 weeks, right? And it occurs in 2% of pregnancies, right? And high blood pressure or preeclampsia or trauma can cause it, okay? Placenta previa. Now notice, this is a normal placement of the placenta, and so where the os is, this is where the baby is coming through, and the placenta is there. But in a placenta previa, see the placenta there, it is completely covering the os. How is this baby gonna come out? Baby cannot come out, right? So what happens is that the baby can end up, if the baby goes into the lady goes into labor with an undiagnosed placental previa, the woman can bleed excessively and actually bleed to death. If it is known, once the woman begins to bleed, you know that's an emergency C-section, right? And it occurs in 1 in 300 pregnancies. So it's fairly common, right? But there are different placements of it. I had a picture. I guess it's not there. Um, right? So you want to know that. So these are the importance of doing an ultrasound, especially in the second trimester. It's not just to find out the sex of the baby, but you want to look at the placement of the placenta. Where is it so that you can plan a delivery, right? Um, in this situation where we're having COVID and we're having a lot of women who now want to deliver at home and want birth attendants and all of that, you have to be careful, right? Now, if the woman is not interested in doing investigations to make herself safe, then you don't want to be assisting in a situation like that because you're going to get the blame. If an ultrasound has been done and the placement of the placenta is identified, that's different. But if it is is a placenta previa, that woman should be delivered in our hospital. All right, because it's very difficult to manage. Uterine rupture. Did you know that this is possible? I did not know this is possible. It can occur spontaneously, or it can occur because there was a previous scar, like a previous cesarean section, or because of trauma, and it occurs in 1 in 1,400 deliveries. So it's not very often, right? But I have been, I have the misfortune of having experienced it. I had a lady who was in labor. We were in the hospital as well, because it's not just outside of hospital these things happen. We were in hospital. She was in labor, and we were preparing her to do an induction of labor, which means that we were going to give her drugs to start uterine contraction. But God is a good God. This was early in my midwifery experience, and I was working with a very senior midwife, was very skilled. And the woman, she was having pains, but they weren't sustained. Now, in order for you to have an effective delivery, your pains should be gradually becoming longer and longer so that it can be of the intensity to push out the baby. But this lady pain was just not very long. So it wasn't it wasn't pushing out the baby, right? So they were going to help her along by giving her some drugs. And the senior midwife left the room and I was there monitoring the lady. And the lady got up to go to the bathroom and she didn't fall. She looked like she was going to fall, and I assisted her to the floor because she was a big woman. And I assisted her to the floor, and I said, "What happened?" And she told me that she don't like how she feel. And when I looked at the lady, she looked white, and I said, "What happened to you?" She said she don't know. She just don't feel good. And when I felt her abdomen, no, please remember this. Her belly felt like a board, and that's a classic sign of uterine rupture. It's a called a board-like feel. It just stiff. You could not. It just was felt like a board, right? So I called the midwife, and as I called her and I told her what I felt, she said, "Call the doctor immediately." And when the doctor came in and saw it, what they did, he just wiped out her belly, ask for a blade, cut the belly, and take the baby out. And we were able to save that lady's baby, and the lady lost her life. Why? The uterus had ruptured, and she was bleeding. She was bleeding so profusely. All of her blood volume was now being pumped into her abdomen, and it was quickly killing her because all of her blood was bleeding out. She was having internal bleeding, and it would have killed the baby. So we were able to take out the baby and save the baby, but she unfortunately lost her life. You understand? So this can happen as well. Okay. Um, right. Right. Let's move on now. So uterine rupture shouldn't can occur. Are we looking at that? We are so behind time, and you guys are going to have to come back to your cooking class late. Um, anyway, I wanted to go through normal delivery with you, but I'm just going to browse through it so that we can get to the looking at the some of the things that you can do for these emergencies, right? So in a normal delivery, a woman may be in labor for 2 to 12 hours, and that is normal. Okay, the woman can may 1 to 2 hours in multiparous woman. Um, well, I can well in the other training you will learn more about working out. Once you start, when you go into labor, we will teach you how to calculate when the baby should come. And if the baby doesn't come at that time, then it's gonna, clue you in that something might be wrong, why there's a delay in the delivery of the baby. All right. Signs of imminent delivery. A woman tell you that she has ruptured her membrane, there's a gush of fluid or a consistent loss of fluid. She's having this urge to push, or you look and this is what you see the baby's head right there. This woman should not be moved. Do not attempt to take this woman to the hospital. She's going to give birth soon. All right. So we're looking at the presentation. Sorry. So that's where we are. The baby head starts to come out. That's what we call crowning. Then the baby head is delivered, and then the placenta. All right. All right. Let's look at this. Oops. Sorry. Trying to hurry it along, but it's not working. Uh,
After right, let me just show that video, and then we can pause for the presentations. Let me see if I can just a second. Are there any questions in the meantime while I find the video of choice? Any questions? No questions? Okay. All right. I have that video for you. Okay, we have 3 hands. All right, go ahead, Miss Williams. Trying to find. Go ahead. In the interest of time, if I can't find the video, then I'll just
Yes,
provider for
there's
today.
one question I wanted to ask. I'm trying to figure out how to frame it while I'm even speaking. It's on the matter of the ectopic pregnancy. So I'm wondering, is there a way to avoid it? I mean, there are some women who
No.
track their ovulation and, probably after a day or two of ovulating, I don't know if the egg would have gone down a little further to say your time, intimacy with your partner at that time to make sure that it's not too early. I don't know if there's no way to avoid it.
Not really. There are indicators or risk factors that may predispose you to an ectopic pregnancy. For example, untreated or frequent vaginal infections or urinary tract infections can predispose you to a tubal pregnancy. Ethnicity, so it's more prevalent among the Black persons here. But generally speaking, it's not your fault. It's not anybody's fault.
The other thing I wanted to find out too, I don't remember hearing it mentioned in a presentation, probably is unrelated, but what are the causes for a long luteal phase?
A what?
A long luteal phase after ovulation, when just before the period comes, that lasts the second 2 weeks before the period.
It has to do with the hormones, usually that person would have a hormonal issue. It might not be very pronounced, but it's usually hormonal based. And then because our body tends to adapt to certain things. And so you might have somebody who has a period like every 30 days. So they have that extended time, but it's their normal.
Okay. All right. Thank you.
But, go ahead, Jasmine.
Yeah, I think I forgot that class and this evening I bring some. Can I get the video, send it in the chat after?
What video you want in the chat, my dear?
This evening, this lesson, I just came on.
No, you can't get it in the chat. It's on the platform.
No, what I mean, can I get it after? Like you will be able to send it to us?
No, it will be posted to the platform. When you go on the platform, you can find them on the platform. It will not be posted this evening, but it will be available to you.
It will be available. Okay, I have to get it
on the platform.
Huh?
You were saying?
Yeah. When you're gonna post it?
As soon as I'm able to.
You can send it to me. I don't do those things. I have to ask somebody.
Pardon me?
Can you send it to me?
No.
To my WhatsApp?
It's going to be on the platform, Sister Jasmine.
Okay.
We will show you how to get to it. That is something that you have to learn throughout the program. How to get on it. You are going to need to go on the platform and do your tests and see how to retrieve your information. So that is something that you will expose to. All right?
Okay.
Samantha, go ahead. Yes. Samantha, go ahead.
No, but I had.
Oh, you answered already? Oh, sorry about it. Tracy, then Carrie Ann, then Sister Nana, and then we will move on.
Yes, hello, good night, everyone. Sister Camille, if I didn't have 3 children before, I wouldn't want to get pregnant. But all those things that can happen, I must tell you, I wouldn't have wanted to get pregnant.
Listen,
but
you don't hear half of it yet, or seen half of it.
Wow, such a risk we take getting pregnant, I didn't even know.
Yes, and that's why we should value birth, value the sanctity of the body, and just don't do this illicit sex business, because God has given us such a gift to carry a life. It ought not to be taken lightly or frivolously.
Yeah, that's true. But I just want to say something with regards to me being pregnant, and I didn't eat anything with animal or flesh at that time, and I decided not to take Materna, what it was at that time years ago. But what I read, I used to read a lot, still do. And I remember, and if it's something you'd recommend, no, but it was based on my research, nobody told me. I took thyme tea. I know exactly before I started feeling pain, I just read. And I know exactly when I was gonna have baby and what was happening in my body and, different signs you can see. And I drank thyme tea. That's regular thyme, skeleton thyme, that thyme tea. And I'm telling you, by the time I got to the hospital, I drank it when I was just leaving my house. And by the time I wasn't in any pain until I was on the way to the hospital, which is around maybe half an hour drive. And by the time I got to the hospital, I had baby. By the time I was wheel upstairs and my husband went back downstairs to get my bag, I had baby. And I personally contributed that to the thyme tea. Is there any facts to that, or is there any
Yes,
herbs or
there
remedy
is. Thyme
we can
tea is a natural ergom, not remembering the term, but what it means is that it contracts the uterus. So
Okay.
after a woman delivers, we normally give them these type of drugs called oxytocin or syntомycin or ergometrin or those are the drugs that we give to help contract the uterus so the woman doesn't bleed. But those same medications can be used to induce labor or to start labor. No, young medical missionaries or birth attendants, thyme tea can cause or initiate labor. So a pregnant woman should never be drinking thyme. If she goes into labor, you're in the bush and the lady goes into labor, you're going to want to put on your thyme tea. Because if she starts bleeding, that thyme tea is going to help you to contract the uterus and arrest the bleeding. But if she's not in labor and you give her the thyme tea, you're going to put her into labor. Or you can't. All right, so you actually speed up your delivery process without it.
And it was very short, but painful, like half an hour. It was very short delivery I had. That was the first child. So I
That
just
is
wanted
what
to
we
share
call
that.
precipitated labor.
Yeah. Yeah. Just want to share that.
All right, thank you for that experience. Carrie Ann, go ahead. We are 5 minutes. All right. Go ahead, Carrie Ann. All right. Her hand is down. I guess she doesn't want to speak again. Go ahead, Sister Nana. Nana, not going to be taking any more.
Oh, good evening, everyone. Good evening, Sister Nurse. Wow, this is really something else. It's pregnancy is not a joke, but thank God for blessing us to be mothers. So, but I had I had my hand up from you were talking about the Bible mothers, and I had my hand up for that.
Oh,
That Rachel was the one that I was gonna say, which you had it on there for Rachel. But um I had the experience in seeing my daughter with the placenta ruptured in her second child. And it was a God sent that the doctor came in and just to check on her. And she said, this woman is in distress. And she said the placenta has ruptured. And immediately they rushed her to C-section. I saw the blood, just like you said it. I saw the blood, coming out, the whole 9 yards, as you said it, because I was in there with her when she had the baby. So it's not a joke. That was a God sent, because she could have lost her life. So I just want to piggyback on what you were saying about the placenta and being ruptured. And her first pregnancy was C-section. She ended up with a C-section. So I don't know, you did mention something like that. It
Yes,
can
because once you
be.
start bleeding, what you want to do is to go and get the baby out. Because
Yeah,
then you're
she
gonna
was
have
already in the hospital when that happened, but her first child, she had a C-section with him, and then that placenta happened, so she ended up with another C-section, and the third child, she ended up with another C-section. So she stopped at the third one, but
good
it's
idea.
not a joke. It's really, really something else for a mother. That's why children really, really do need to respect their mom, or their parents on a whole, because it's not a joke. Giving birth to a child is nobody's joke.
Oh, I tell you. Um,
So
the split second between life and death is so
it's right
short.
there.
It's
It's
just right
right there.
there. It's just right there.
I
But
didn't
many
hear you.
persons don't understand the risk that they take, and I think if they did, they would probably um have better thoughts about pregnancy.
Yeah.
But it's not really taught. All
For
right, we
me,
are.
for me, I had the baby being in the fallopian tube. I've been through that too. And that one is really not a joke. That one is really, really a serious one. And then all my children, all four of them, I had dry birth. The water broke before the children come. And
Okay.
that one is, I didn't hear you talk about that one, but that one is not a joke either, to have the baby dry without the water.
It can be challenged as well.
Yeah.
Unfortunately, in the obstetric community, it's not considered an emergency.
Mm.
Um, it's an uncomfortable birth, but it is quote unquote nothing to write home about. There's no great emphasis placed on it,
About it. Yeah.
except that the woman's risk of infection is greater. But outside of that, not much thought is
It's
given
done
to it.
about it. Yeah. Thank you for allowing me to
Yes.
hear. Thanks.
All right. I was going to show this video, but I see that Sister Cleo has put it in the chat, so I'm gonna forego showing the video and just take the other two hands, and then we'll close so that we can start the presentations, because we don't really want to go over too much time. Miss or Mr. McGregor, and then Lisa. Anif?
Oh yes, good evening, everyone. I listened. It was really informative, nurse. Well done, I must say, because I have my children and I didn't know all of these information, and it would be good if these things could be taught in the church so that the young people or those who haven't had their children would have really learned what they are going to go in when they are married before they have
Yes.
children. I can remember I have when my first birth was dry birth, as she said, and it was really horrible. The second one was overdue. I don't know if you mentioned much about that, but overdue. Up to now, I haven't understand much about it, but the baby was so white and have something on her skin, and she was big, yes, when she was born. And the third one now, my son, he when I had the baby, I had to rush to the hospital. I almost died. They said the placenta, I think, stayed too long, so they were almost going to rush with me at the hospital, and the doctor came and he did what he must do, and to God be the glory. My son is here. Now I have a twin, and yes, I'm a twin. They were like 13 pounds, and I'm a small body person.
What do you mean? 13 pounds each?
13 pounds they both weigh when they were born.
You sure?
Yes. Not
Okay.
one, yeah, not one, but weigh 13 pounds, you know.
Oh, you frightened me.
One, yeah. I was carrying 13 pounds.
Oh, yes.
Yes.
Well, I've actually seen one baby weighing 13 pounds, you know.
Oh.
Yeah, but
And
the mother was a very strapped in woman, tall. She was 6 something, and the father was 6'5", and she was big, and he was big. So of course, the baby was big. When you put the baby in the cot, he just full up the cot. He looked like a little toddler, you know. So
and I also my twin, the first one that was supposed to born was what you call it now. She turned crossways, so she was unable to born, so they had was to take the babies.
okay.
Right? Yes, and so I'm just sharing my experiences, right? And yes, and the born and everything was good. So, and I also had a miscarriage. Yes. So my
If you were in a
question,
midwifery class now, I would ask the class to calculate your gravida and your parity.
and
But since we are running against time,
yes, and the
gonna leave
baby,
that out.
yes, and but nurse, I want to ask a question now. You said it is some abortion or something. There's a name that you give for that. No, my question I want to ask, where the Bible is concerned, how would you address that
Address
as
what?
an abortion?
Abortions? Yeah. As to, you have to be more specific. As to the right and wrong of it, as to what? What
No,
what
you
is
call it you call a miscarriage something miscarriage, and I think it mentioned something about abortion. That's an abortion.
Okay, so the term abortion just means to abort a process, which means pregnancy is a process. It lasts 9 months, 40 weeks, 270 days. So if it stops 1 day short, 1 month short, the process has been aborted. So the term is used loosely to indicate the termination of pregnancy before the time.
Okay.
So the term abortion is not, quote unquote, a bad thing. It's just saying that the pregnancy was terminated or stopped before the time when it's supposed to be stopped. We use the term abortion to speak about the termination of pregnancy before it is viable. And viability is determined based on the gestational age, which is how old the pregnancy is. And I did say that in the Caribbean, it's like about 28 weeks, because we are not equipped with the mechanisms to ensure that a premature baby life is kept alive, then, so to speak. But we have had pregnancies, women have had quote unquote abortions at 22 weeks, 24 weeks. For Jubilee, 24 weeks that have survived. For University Hospital, 22 weeks that have survived, that I can remember. So those are quote unquote terminations or quote unquote abortions, but those babies lived, right? When you talk about criminal abortion, no, this is where the woman initiates. She definitely does something to stop the pregnancy, right? No, Job speaks to that. Job said that he said something about his mother. I'm not remembering right now, but he said something about his mother terminating his life before time of delivery. The Bible also allude to it with Rachel, drinking something that could cause termination. Maybe I mixed up the character, but something like that. So the situations of that existed, and as I say, it was mentioned not in any detail in the Bible, but the right and the wrong of it is for another time that cannot be discussed here, because it's not going to be the situation not going to end. And there are medical criterions as to say whether it is right or wrong, or when it should be done, or when it can be safely done, and all of that. But we're not going to get into that with that. But just to say that the situations existed, and it was mentioned in the Bible. So if it was mentioned in the Bible, it means that you should be able to get an answer of some sort from the scripture. But we will take that up on another class. All right.
Okay, thank you. Thank
You're
you.
welcome.
Yes, thanks.
Lisa, you can go ahead, and then we won't take any more because we want to finish on time today. Sister
Okay.
Jasmine, put your question in the chat. Go ahead, Lisa.
Yes. Alluding to what Tracy said about the Syme. I know that that works, and it works very well. I did it 4 times, and my labors are very quick. But that, as I say, it is if you're sure you're in labor, because when you go to the hospital, they kind of treat it like a business per se, and when they need beds, they usually induce labor. So I've heard them talk, the doctors talking to themselves. You understand? I've heard it first and several times, and I know for sure. So if a woman is going into labor and they're sure that it is labor, they can do it, or they want to speed up labor and induce you. You understand? Because I was in the hospital, and then they said that they're going to induce me. I said, all right, not bother with that. And I just sent for my time and that was it. You understand? Yes, yeah.
I have had that
I have no time.
experience in the
I have no time
hospital,
to lose.
and
I'm about business, so I just went in and did my business and come back home. That is so. That is so.
I have had that women sending home for their time teas. I've seen
Yes,
that.
it does work. And when they want to give you the hypertensive injection medication too, I sent for my garlic. You understand? And I brought them my own. But as it say, you have to inform yourself. Inform yourself. Information is key. That is why we need this medical missionary work is so important. You understand? Because when you know what you're doing, nobody can tell you anything that goes contrary to. You understand? You can listen to them, but you can make educated
But
choices.
the key is, if you're informed, it makes you better, makes you able
Right,
to make better
right,
decisions
right.
about your health, about the health of your baby.
So
And
true.
sometimes it's not just about warding off complications. Sometimes
Right,
it may suggest strategies that may in their eyes seem helpful, but
yes,
you're not comfortable with it. And because you're knowledgeable and you're able to make a better decision, things work out better for you. So in
right,
everything, being informed is important. Obstetric or midwifery emergencies does not end at delivery. Just to close by
right,
saying that, thank you so much. It doesn't end at delivery. After the woman has delivered, you are still not out of the woods. Complications in terms of bleeding, in terms of infection, in terms of seizures can occur. You also have another life. You have the baby. Complications may develop with the baby as well. And those are some of the things that we hope to expound on in that type of training, in a midwifery setting type of training, so that persons can be informed. I've heard of women being advised to put things on their babies that it's not right and can cause infection and even the death of their babies. Various different things, and the baby being born and being taken care of by a loving parent does not eliminate the risk of the baby dying in the cot, what we call sudden infant death syndrome, just die like that because of um, feeding issues and all of that. So the risk doesn't end there, right? And so if we inform personnel, we're able to educate them, then we can secure life. All right. So without further ado, we'll end today's presentation with that. The link for the delivery, normal delivery is posted. You will see it in live colors, and so you can get to look at that. And thank you for your questions. And I'll just pray to close. Thank you, O Holy Father, for the information that you have given us, for us to share with others so that they can be educated, so that they can make informed decisions. Be with the presenters as they come. In Jesus' name I pray.